First of all, I'd just like to say thank you very much to Fisher Paykel and MedTech for inviting me to speak. It's a very unique and lovely opportunity. There's absolutely an abundance of research articles that show that perioperative programs do have a great impact on outcomes, but very few of these address the ability for scale, gather big data to show that they do meet the triple aims of health, and what value they bring to all stakeholders in the entire continuum of care. If we don't bring value to the entire stakeholders, we're not going to get implementation, and that's something that we wanted to gather data and prove the concept of. To do this, we actually joined forces with an orthopaedic surgeon in Brisbane in Australia, and working with 187 of his hip arthroplasty patients, which has gone on to over 350 now. But what I'll be talking about is the 187, where we gathered a lot more data. These 187 patients, they received a 9-week online perioperative program, and it was an online one, using a mobile cloud platform called HealthLinks. They received individualised interactive packages of care, which was advice, activities, messages of support, all automated and strategically placed along a timeline, 3 weeks before surgery and 6 weeks afterwards. We wanted to validate what we had been told with some of the value propositions for surgeons and patients, but also all stakeholders in the clinical team inside and outside the hospital setting. Because we believe that the only way to get truly patient-centric health is to, and that is actually sustainable and viable for everyone, is to have a solution that delivers value to all of them and does maximise the outcomes. Because of the time constraints here, I will actually talk more about the feedback that came from surgeons, which was very, very enlightening for us. One of the things that they told us was that they were able to deliver standardised, consistent care outside of the hospital setting, which was leading to decreased post-op complications and also reduced variability in outcomes. Care became a lot more coordinated because everybody in the care team, inside and outside the hospital setting, was able to access this platform and see the single patient plan that was in place, irrespective of where they were located. Another opportunity came. They were able to deliver conservative packages to bridge the gap between surgical and non-surgical options at a minimal cost and with minimal use of resources. The excellent standard of care was reported by patients and also by the clinical team as well. They could provide a greater depth and breadth of care, which they couldn't actually do in consults or didn't have the time, although they did have the desire to do it. And they could easily add additional information which could meet patient-specific needs. A prime example was an anaesthetist. He reported that by producing a 5-minute video with advice and points for the patient to consider, plus a virtual tour of the operating theatre, along with automated emails, he was able to save himself about 30 hours, what would have been 30 hours of consult over 187 patients. And he said he was able to provide a markedly improved patient experience. The automated emails were fantastic because it reminded people about some of the supplements they were taking or some of the drugs and when they needed to cease taking them. Patients were better prepared for surgery and they were less anxious when they came in, and this decreased some of the surgical risks. The other thing they did comment on, that there was less cancelled surgeries through patient misunderstanding and less complicated procedures due to pre-op complications. Another thing the surgeons told us is that patients didn't drift away because they were able to provide them with this electronic information well before their operation time, or in a mode that would actually keep them engaged until it was time for an operation. They didn't drift away and go to another surgeon, which was quite good, and it influenced those patients to actually stay with them as well in a very competitive market, in the private orthopaedic market. The surgeons in Australia reported to us, which I thought was a little bit alarming, that because our platform enabled them to have measurable and repeatable patient education and trace and track the patient interaction, there was decreased risk of litigation, and also there was a very strong defensible position if there was litigation, something that we hadn't even thought of or were aware of. Another good point with the Australian surgeons particularly was that they were able to supply rural and remote patients excellent perioperative care, particularly when services weren't readily available or it was very difficult for patients to access them throughout Australia. This also enabled enabled them to expand into more medical tourism and also being able to do a lot of work in the mines and also on oil rigs. Other factors that they actually identified to us was that there was less staff time spent on information transfer and more on patient-specific needs. In some cases, they were able to get an earlier discharge of even over half a day because the family and the patients were actually more confident to go home and safely self-manage. And that was one thing about our platform. The patient was able to invite as many people as they wanted to come onto the platform and access their plan. So we got far better understanding from family members as well, and also less disparity in opinions about the expectations of what this operation was going to, the results of that were. Just moving on from that, this was the data that came out of the 187 procedures. 47% of them were over 60 years of age, and it was no barrier to have an online program. Within the hospital, they were also provided with an iPad, so they could continue to be educated within the hospital as well. 35% of them lived more than 100 kilometres away from the hospital and outpatient clinics. 90% of them said that their care plan significantly helped their recovery at home. 95% were confident in caring for the wound and could spot if there were complications, which meant a lot of things did not get escalated. 91% said they found the actual platform very easy and helpful to use. And 81% said they had a significant decrease in anxiety due to the pre-op program. And we found that that pre-op program was really very, very valuable and important. A lot of feedback about that. 73% of the patients said they didn't need all the outpatient clinics that were scheduled for them. 98% referred frequently to the post-op instructions after discharge, and of which 85% said it had increased their ability to understand and perform the post-op exercises. These post-op exercises were supplied as videos, which they could stop, start. They could also video themselves on their own camera and put it alongside and compare their activity compared to the video that was running. And this was extremely helpful for them. We had one particular patient who was or is a cricket umpire, and within 7 weeks of his hip arthroplasty, he was back on the cricket pitch umpiring, and he said he couldn't have done that with his first hip operation. Thought he knew everything, but the second time when he had this program, he just said it was just fantastic. Couldn't have done it without it. So by actually strengthening patient engagement and building very useful data, and gathering this useful data is something that really, really interests us, because it does prove what the value is to all of the care team. We have found that the online perioperative programs delivered on a cloud-based platform so that you can get people accessing it from wherever they are. It can actually be a step change towards delivering value-based care. And value-based care that is basically financially sustainable and scalable. And the platform itself has actually been starting to be used for chronic disease prevention in Queensland in a 4-year project that's just about to start next year. One of the surgeons that we're working with in the South Tees Hospital Trust in the UK has said to us, with his surgery and the devices that he uses, he can only get incremental differences or changes and improvement in the outcomes. Where he can get the most outcome is outside of the clinic and hospital walls. And he was going to use our platform basically for research work, and about 3 weeks ago he said to us, to hell with the research, the ethics, everything else, I'm just going to implement this and do it, gather the data and improve my program and my delivery on a cycle basis, which was tremendous endorsement for us, and we were exceptionally satisfied that he did that, just exactly that. That is me. That is what I'd like to say, and to say thank you very much.